Thank you very much, Christian, for this very kind introduction, I have to say. I'm very happy to report some experience from the treatment of a patient, as you said, intoxicated with an overdose of MDMA, which is better known as ecstasy. For the clearance of MDMA from the bloodstream of this patient, we have used CytoSorb. Next slide, please. The summer of 2019 has been very, very hot, especially in Freiburg, so that people spend free time around the lakes near Freiburg. One of these days, next slide, please, we received an emergency call saying that there was a young man unconscious and the emergency physician on scene assumed an intoxication. Initial assessment revealed a serious condition with hypothermia, tachycardia, hypertension, and a GCS of only 6 of 15. Bystanders reported consumption of MDMA and alcohol and probably some of unknown other drugs. Next slide, please. In our emergency room, the patient further deteriorated, showing persistent tonic-clonic convulsions, vomiting, hypoglycemia, and execosis, so that soon after arrival, we had to deeply analgosedate the patient and intubate him. Next slide, please. Blood gas analysis showed acidosis. This is venous blood gas analysis, and a serious hypoglycemia of 31. And we did toxicological screening tests that were positive for benzodiazepines, probably from the initial treatment for the convulsions. These screening tests, however, cannot test for MDMA, so we couldn't find initial evidence for its use. Next slide, please. Luckily, the cranial CT scan in our emergency room didn't show any abnormalities. Next slide. As a background to this case, at that time, there were various media reports about overdosed MDMA batches that were in circulations in the week before. Therefore, we also collected blood samples for our Institute of Forensic Medicine for analysis of MDMA and MDMA degradation products in these patients. Next slide. What we are talking about in this context is the serotonergic syndrome. MDMA stimulates the release of serotonin, dopamine, and norepinephrine, which in turn leads to the desired feeling of increased energy and euphoria in the patients. However, overdose can lead to trauma, coma, seizures, liver and kidney failure, hyperthermia, rhabdomyolysis, and coagulation disorders. And this is exactly what we have observed in our patient. Therapy options, most importantly, so far are very limited and limited only to controlling the complications in these cases. Next slide. And this is what we saw in our patient. So it's serious hypothermia. It was 39 to 41 degrees, massive rhabdomyolysis and multi-organ failure with liver and kidney failure and severe, very severe coagulation disorders. The predicted mortality, according to SAPS-2 score, was 95% in our patient. Next slide, please. And this is what the CT body scan looked like. We have seen signs of hypovolemic shock and also the bleeding signs in endoscopy, which we did because of anemia in this patient. Next slide. In our case, we extended the limited treatment options by just adding CytoSorb to the renal replacement therapy machine. Next slide. The most important question is, did it work and how can we show that it worked? We have to say definitely it worked. As expected, we observed a rapid decrease of IL-6 and myoglobin levels. It is well known and well examined that both substances are well absorbed by the adsorber. So this was not a real surprise. Next slide, please. But most interestingly, and not described before, we also observed a similarly rapid decrease of MDMA in the patient's blood over the first 3 days of treatment. And we calculated a half-life for this substance in our patient of 12 hours. Next slide, please. But from our observation, we couldn't really know if this is specific or done by the cytokine adsorber or by the CytoSorb adsorber. Therefore, we wanted to further examine this observation, and we designed an in vitro setup to assess the adsorption capacity of CytoSorb for elimination of MDMA. And what we could show was a similar cause of reduction of the MDMA levels in a laboratory setting as we observed in our patient. Next slide. The patient finally, over the course of, in the end, 2 to 3 weeks, recovered without any serious residuals. So we can say the treatment was definitely successful. Thus, I would like to conclude that our case is the first description of a successful application of CytoSorb for MDMA intoxication in humans. Our in vitro data confirm the successful adsorption of MDMA in the CytoSorb adsorber, and thus CytoSorb can be part and should be part of a causal therapy in severe MDMA intoxication. Next slide. Finally, I would like to invite you all for our forthcoming online FELS symposium on extracorporeal lung support on November 19 and 20, where we also talk about cytokine adsorption in combination with ECMO. Thank you very much.